Hi, this is the treatment group video for schizophrenia, spectrum, and psychotic disorders. My name's Casey Dahl, and my client's name is Dan Plotz. The differential diagnoses I have for my client are schizophrenia and schizophreniform. Schizophreniform was ruled out because it didn't meet criteria B of the duration. Wasn't long enough for my client. My client's story is that he's a 36-year-old man who is completely dependent on his mom. He can't hold a job or relationship or anything, and he has been hospitalized multiple times on and off. He goes off his antipsychotic medication, and then he is homeless for a while and lives under bridges, and then the police bring him back to his mom's house, and his symptoms are that he walks very strange. He will walk a couple steps and stop or spin, and then walk some more steps, and then he talks in rhymes a lot, like Dr. Seuss. And then he's been very verbally abusive to his mom, and now his mom is afraid that he's going to be physically abusive to her because he's threatening her and saying a lot of scary things that she's afraid he's going to hurt himself or her. Dan has hallucinations or beliefs that in high school his high school teachers were out to poison him, and then he thinks his mom is also feeding him bad food, and he thinks that she wants him to jump off a cliff because she believes he can fly, or he thinks, and so he has all these different hallucinations that or voices he's hearing. So yeah, he's in the hospital again and being treated for schizophrenia. The multi-axial diagnosis for the client is axis 1 is schizophrenia, axis 2 is none, axis 3 is previous hospitalizations, axis 4 is that he's dependent on his mom and lives with his mom, and axis 5, the GAF, is 28. The theoretical perspective that I have for this client is the biological perspective. The client's symptoms may be due to a genetic predisposition for the disorder. If the client has a family history of schizophrenia, he's more likely to develop this disorder as well. There's also a link between deficits in dopamine receptors, causing more dopamine to be in the brain, which causes the development of this disorder. If the client has a deficit of dopamine receptors, and there's an excess amount of dopamine, and that's causing the manic behavior. The client can also have a deficit of glutamate in his cerebral spinal fluid that has been shown to lead to schizophrenia development. And lastly, the client may have larger ventricles in his brain than a normal brain, and that causes there to be less brain tissue, which also can be linked to the development of schizophrenia. And that's all I have for this client, for this video. Thank you.